Often a combination of different types of stimuli will be needed to act as counterpoints to each other in experiential therapeutic work. A type of stimuli which can be beneficial in their own right, but also a helpful addition to aversive and addictive work, are supportive stimuli. Supportive stimuli are those that help the participant to access resourceful states, like feeling more relaxed, inspired, or reflective. There are a number of typical scenes that, on average, will be pleasant to be in for most participants. The types of places you'd expect to visualize during meditation: in a forest, by the ocean, in a meadow, and so on. These types of scenes are popular for a reason. They do suit a lot of people a lot of the time. However, the mixed reality therapy room places a strong emphasis on customization, so seeks to move beyond off-the-shelf solutions. Customization is important for a number of reasons. Firstly, with a client or patient-centered ethos, many styles of therapy emphasize starting with the participant and working outwards, building a suitable program of evidence-based support around their needs, rather than hoping that they will fit into a one-size-fits-all approach. Even when there is a reasonable match between participant need and supportive resources, the process of tailoring the environment to the participant's needs can result in an even more refined fit and a sense of co-creation, with room to modify as needed. It allows diverse needs and accessibility to be taken into account, and contraindications to be accounted for. As with the workflow for aversive and addictive stimuli, initial work can help clarify what resourceful states are to be targeted, and what types of objects or scenes will be most appropriate. The experience room can then be layered with a relevant scene, or can be entered as an empty space that can be a blank canvas to the creative process of choosing supportive stimuli, carried out by the participant and supported by the guide. Objects may be simple, three-dimensional shapes, or more photorealistic 3D objects. Or they may be an immersive scene, or a combination of scene and objects. This combination provides for a richer sense of immersion and the opportunity for interaction. The experience room, layered with supportive stimuli, may simply be a nice place to visit to unwind. Or it may be a more active environment with directed therapeutic practice in mindfully perceiving the space, creating, and interacting with objects contained within it. When used to assist work with aversive and addictive stimuli, supportive stimuli can serve as a useful way to unwind at the end of a session, or as a safe place to transition to if the participant finds the work too challenging. This can be achieved either by entirely switching the scene, or by introducing supportive content alongside more challenging elements to help temper their effect. The consultancy room is always available as a neutral space, but supportive stimuli by design have an actively soothing experiential quality. Supportive assets can also be a helpful tool for priming participants before therapeutic work that benefits from a more relaxed, reflective stance.